And I'm honored to actually join the ranks of the youth, thanks to Sandeep, because I normally don't consider myself that, but you gave me a reason to think of myself that way. So I learned one very important life lesson today already. So what I'm going to do today is talk a bit about mHealth and social media together, and quite a bit about a range of technologies from mobile phones to sensors and social media. But what my presentation will drive towards is how these tools and technologies, echoing what a lot of the previous speakers mentioned, how we can bring the technology together with a different paradigm in public health and actually change the practice of public health. So marrying the political and the technology together, and what kinds of paradigms can be used to think about public health in the future, or what it may look like. The mHealth Alliance, we often speak about the continuum of care. A lot of our work is with maternal and newborn care and mobiles. So this sort of general continuum of care we can actually use to map a lot of the mHealth interventions that are out there in low resource contexts around the world, most of them using SMS, but we can see plenty of applications working on everything from prevention and using SMS to provide health education, to diagnostic and screening applications, monitoring, and of course data collection, all the way through to treatment. And I think the next generation of mHealth will see a lot more peer-to-peer types of applications. And just to give you an idea, often we have the mobile phone, but it's also attached to a peripheral device that can enable diagnostics and screenings and so forth. And for example, an example I'm going to talk to a bit later deals with asthma, where you can actually put a sensor in an asthma inhaler and get the geo-coordinates of where someone is when they use their asthma inhaler, and then aggregate that data and start filling in some of the public health data holes in our knowledge about where asthmatics are in place whenever they find asthma triggers. When we think about NCDs, we can think about a whole sort of ecosystem of communications, from the patient at the center to communicating with other patients or your peer-to-peer to the various sorts of care or medical caregivers. And several years ago, I used to work at the Institute for the Future, and we actually created a construct that we use to help everyone from the CDC to companies and foundations think about how to innovate and create new types of mHealth or social media applications. And the paradigm was the personal health ecology. And what the personal health ecology does is it looks at a patient and the variety of technologies, relationships, activities, places, products, information, and providers that all can be very different per patient. And how do we take advantage of this ecosystem of relationships, essentially, that people have, and build the tools that can help them manage their chronic diseases? And we often found this was a very useful tool to looking at very different types of personal health ecologies by socioeconomic status or geographies and so forth. And so from that, we often develop many applications with our clients. And so now I want to switch to just a kind of quick overview of some of the applications we see out there in the mHealth, and actually even to the wireless health and integrated with social media on occasion. We have a great deal of different applications designed for diabetics. Glucose Buddy is one of the more popular ones that enables diabetics to track their eating and testing of their sugar levels and so forth, or A1C, hemoglobin A1C levels, and then sometimes even share these. And a good example is Manny Hernandez is a diabetic in Berkeley, California, who used a Ning social networking platform to create the two diabetes community. And he also has a Spanish-speaking one called S2 Diabetes. And one of the interesting experiments they've been doing over the last year is this two analyze, which enables people in the two diabetes community to share varying levels of their A1 or hemoglobin A1C data and tracking of that with other people in the network, but also, if they choose, they can share this with researchers to begin, so they can get a better idea of tracking and outcomes of diabetics in this community. We also see examples such as Sana Mobile, which won the mHealth Alliance Innovation Award last year. They've recently launched an initiative, or last year they launched an initiative with the Narayana Rudralayala Hospital in Bangalore, which is an effort to try to screen 1.5 million citizens of Karnataka for cardiovascular disease over the course of a year. The Carlos Slim Foundation, or CARSO Foundation, have invested in Casa Salud, which is a sort of combination telehealth and gaming type of platform to give people information about obesity and give them the tools to perform better self-care for chronic diseases. Asthmapolis is another example for respiratory disease or asthma. And you can see this, the asthma inhaler, which has an embedded sensor that every time an asthmatic uses the inhaler, there's a geo-coordinate that gets mapped, and we can begin filling in a great deal of information about sort of missing holes in our public health data, which also may reveal inequities around exposures to environmental contaminants or triggers of asthma. And often we hear about cloud computing increasingly. I mean, it's been around for quite a while. If with the advent of Hotmail to Gmail and so forth. Joel Selenico at Datadyne, a popular mHealth application, often refers to Gmail and Hotmail as the most successful mHealth interventions ever, and that they are now, you can access them on a mobile phone, cloud computing. But here was an example of a cloud computing project that was deployed in Honduras for self-management of diabetes. But the program is run by the Veterans Administration in a university in the U.S., but for low-resource context in Honduras. And then moving on from sort of the cloud computing examples, we have at UCLA the Urban Sensing Program, which uses sensors. And what's interesting about this program is it enables you to find out what impact the environment may have on your health, or asthma, for example, but also track your contribution to poor environmental outcomes, meaning if you're driving a lot and contributing to poor air quality. So providing these types of feedback loops and so forth. So, and then one of the final sort of areas of social media and mHealth in this sort of nexus of the two is the use of games and gaming, or what people are increasingly referring to as gamification of health, for example. In the last week, the Citrus, in their mHealth program at UC Berkeley, created an Owning Asthma application that they're targeting for largely the Latino community and African American community in Oakland, and then in the Central Valley in California, where you have very high rates of asthma in the African American youth and Latino communities. And this is a game where you get points for identifying the triggers, environmental triggers, and ideally the sort of agricultural industry polluters, or urban polluters in the case of Oakland. And what the idea is that through engaging youth through this game, you have them become more aware of the political or social drivers of their asthma outcomes, and then get them more engaged in civic action around addressing the root causes of the triggers of their asthma. And they've also developed another version of this. It's not an NCD, but it's Dengue Torpedo. But what's interesting is it's a similar type of game that's being targeted towards finding stagnant water in the favelas of Brazil that may enable the dengue outbreaks. And another area that we're very interested at the mHealth Alliance is this intersection of mobile money and health and how to leverage that. And Chom Gomka which means Get a Life in Swahili, is a program that's been designed to enable women or couples to generate microsavings that can be used to pay for their care. I think this is an interesting thing that we need to take advantage of in chronic disease as well, with the success of microfinance and microinsurance. How can we, as public health professionals, with all the data we collect, make the data valuable for the people at the base of the pyramid? And we can also use, there are also lots of, I was recently a judge for the Saving Lives at Birth Grand Challenge, and there are lots of interesting proposals using this mobile money and mHealth together to do incentives or vouchers for care as well. And so, but what often gets lost in the discussion of technology, and what is sort of the thing that gets in my craw often in the technology discussions, is we lose sight, in our interest in the technology and getting the platforms right, which we need to do. We lose sight of the social drivers and social determinants. And so where's the app for that? How can we get, if we look at the iPhone or the iTunes store right now and look at the 6,000 mHealth apps that are currently available, I wonder how many address the social determinants, and how can we shift that, get the innovators out there to think more about integrating that into the equation, because at the end of the day, as we know, long-term sustainable public health changes have usually required social movements and directly addressing social determinants. And as we've heard many times say, it may not have been a Facebook revolution, but Facebook and YouTube, Twitter, and so forth have been playing a very powerful role in these social changes. And so one of the things I've been working on over the years, in my doctoral studies, I had a combination of anthropology, urban planning, and health policy. I was quite fascinated with the healthy cities movement early on, which seemed to have, in some ways, in my mind, stagnated. But I think with the technology tools we have now, we have a great opportunity to rethink the healthy cities movement. And I've been writing a bit about the Healthy Cities 2.0 and how we can take this notion of, the availability of sensors and gaming and so forth, but with the social determinants in mind, and bring that together in new ways. And Ilona Kickbush, in a recent book on policy innovation for health, has some very interesting thoughts about how we can do that with the technology, and also with things such as enterprise architecture, and how the efforts now that the mHealth Alliance were involved with some networks of folks building the enterprise architecture so mHealth can scale and you can have all these devices interoperate. But then how do we scale public health into other sectors as well? Is how Ilona Kickbush would think about that. So this decision, the technology decisions we make right now may sort of get us stuck into certain, create certain limitations in the future if we don't think more broadly about these social determinants. And there are also ways to think about public health, and cities as platforms. I believe our friends HHS with Tim O'Reilly will probably be able to tell you more about that. But how can we build platforms that enable sharing of data, or taking advantage of open data, the quasi-ubiquitousness of mobiles and so forth, and have the citizenry become co-creators of public health with us. And there are lots of platforms out there more on the city planning side that resemble this healthy cities movement, but how can we create more, learning from, to analyze, and so forth, to do this in public health? Localocracy is one interesting example that focuses on the local politics and helping people identify problems and then build constituencies around that. Building at the local and then scaling to more national and global. These platforms that help you understand the walkability of your neighborhood, and working with city planners or city officials to make certain communities more walkable. And as I mentioned, taking advantage of the open data, especially given what, with mobile and the apps we could develop in public health, would be an interesting way to go as well. So some of the lessons I just want to end up with is, in many examples, a lot of the examples we have out there in the sort of broader global health scheme, the mHealth applications typically that we have focused on have been for infectious diseases such as HIV, malaria, and so forth. But many of these platforms, we can scale them across to other diseases as well. It's using the same platform for things such as drug adherence and reminders and engaging people with health education. And we can integrate NCD applications with a lot of these other existing ones. And the other thing is, a lot of the applications I provided in my example were applications on smartphones. And we often come up against the fact that in much of the world, in very low resource context, smartphone penetration is fairly weak right now. However, in many markets, the entrepreneurs and innovators are beginning, even in Africa, to develop these things they're focusing for the next 3 to 4 years, where smartphones, as the price points come down, and just there'll be more and more, there'll be a much bigger market for some of these applications. And just a statistic I found was that in 2010, last year, 62% of mobile users switched to smartphones in Latin America. And actually, many of the what was interesting about in the article was that many of the applications built for smartphones that people actually use are designed to have SMS integrated into the app. And I think we're going to see a lot more of the applications that work on the peer-to-peer and can help with sort of the social media type of connecting and sharing of data and organizing. In fact, right now we talk a lot about the social web, but a lot of technology analysts and futurists are saying that we're not actually going to talk about the mobile web. In fact, we will no longer use that expression because the web is just going mobile. In many markets, people just access the web via the mobile, and many of these social networks are very much on your mobile. So that's pretty much my presentation, and as I mentioned, I think there's a great opportunity here to think about the technology in paradigms such as healthy cities and social movements together that I think in the future could change how we actually practice public health. And I think that's the key lesson I want to drive home is let's talk about how are these tools going to change the actual practice of public health and how we train the next generation of public health folks to do it better than my generation, I guess. Thank you.
Thank you, Jody.